Are you a can kicker or are you a problem solver? Well, to dig into that question and decide what you are and what you will be in the future, let's go back and dial back on some history. As a physical therapist, I worked with a lot of patients, did a lot of intakes with patients, asked about their problem, how long they had their problem for, why they wanted to get help, did a lot of that. And here I remember this one time doing an intake with a patient, getting all the data on the patient, and then discovering what the patient needed. There was orders for a physical therapist to treat the patient for what they were there for, recommended what they needed, moved forward and actually handled what they needed. Patient was discharged and off they went. Dial forward 3 years down the line, and the patient shows back up again with an order for the same area that I had treated them for 3 years earlier. And I was a bit perplexed, and I said, hey, I thought we had this handled. And they said, well, it was, and then it came back. And that's when I started thinking. I started saying to myself, you know, I thought I handled it, problem solver, but the person was sitting there again. At that point, I started looking at my intake process with patients a little bit differently. As I started asking patients questions about their problem and how long they've had their problem and what they had tried in the past to solve their problem, the one thing I know for sure, 100% of the patients who had had a problem more than a year had tried something else to handle their problem, and they happened to be in front of me at that time. So now dial me to where now I am working with my husband, Dr. Mike Carberry, in our practice in Pennsylvania, and I'm a case manager doing an intake with a patient. So I'm actually doing that intake. And in my head, I'm saying to myself, I remember that story as a physical therapist, that patient that came back 3 years later with the same problem that I thought was gone and solved, but never truly was solved. And now I am working with my husband in a practice doing intakes with patients. We're seeing 15 to 20 new patients a week. I got a lot of experience with intakes. The one thing that I picked up was this: patients are constantly searching for the solution to their problems. This is what they're doing, whether it's low back, whether it's knee, whether it's neck. Every patient that walked in our door had a problem, and that problem was long-term. They'd had it for 5, 10, 15, 20 years, and they were in our office at that point to look for a solution to their problem. And I started really questioning, saying, all of the activities, everything they did in the past to solve their problem, why was their problem not solved? And as I looked at it, most patients had tried chiropractic care in the past. Most patients had tried physical therapy. Most had tried some form of pain relief, whether it was over the counter or prescription from their doctor. Some had tried massage therapy, some had tried acupuncture, some had tried exercise in the gym, some tried yoga. But the one thing I know for sure, there was a whole lineup of things that that patient tried to solve their problem. And here I'm sitting here now, intake after intake after intake. And Mike and I are having this discussion, which is, are we going to be part of the problem? Or are we going to be part of the solution? What does that mean? Well, part of the problem is, are we going to work with this patient just enough to give them some relief, to move them on in a year or two that they end up in somebody else's office? Or are we going to actually handle the problem for them now so that they can go back to their life and not have to search for a solution? That was when we decided in our practice that we were going to be problem solvers. No longer were we going to kick the can. And kicking the can, what does that mean? That means when a patient comes to you and you do their intake and you discover they've had the problem 5, 10, 15 years, is what you're doing going to actually handle their problem? Or are you going to do just enough to make them feel better, at which point they end up in somebody else's office? That's a can kicker. So what are you? Are you a can kicker or are you a problem solver?